Often, when you get into the real world, the effectiveness of vaccines falls short of the original efficacy. That is not at all the case with the vaccines for COVID-19, because the real-world effectiveness is even more impressive than the results of the clinical trial. One example, the University of Texas looked at 23,000 of their employees and found that the incidence of infection was 0.05%, markedly lower than unvaccinated individuals. The CDC has multiple MMWRs reporting on various aspects of the real-world effectiveness. Importantly, a recent paper in The Lancet reported on the experience in Israel, which, as Senator Burr had mentioned, has done an extraordinary job of getting their citizens vaccinated. And what we have seen is a remarkable diminution in the number of infections that reached a critical turning point when they reached a certain percentage of the individuals who were vaccinated. It wasn't only limited to Israel. Another recent paper in the country of Qatar showed a similar type of a result, in which not only was the mRNA vaccine highly effective in over 300,000 individuals tested in preventing the original wild-type virus, but it also had a very interesting capability of protecting against mild to moderate disease of a problematic variant from South Africa, the 351, and protected virtually 100% from severe disease, including hospitalization and death. And so when the president makes the goal of 70% of adults receiving at least one vaccine by the 4th of July, we believe that that is an attainable goal. The reason we feel it's important is that I believe that we are about at that critical turning point when we get a certain percentage. We don't know exactly what it is, but clearly the majority of individuals in the country vaccinated, we will see a sharp turning point and a marked diminution in cases. And so, as I said the last time I testified before you, we are in a race between the vaccine and the virus. If left to its own devices, will continue to surge. Based on experience thus far in this country and globally, I feel confident that if we continue to vaccinate people at the rate that we're doing, that we will very soon have a situation where we will have so few infections in this country, we will begin to return to the normality that all of us desire so much. Thank you very much.